Hey everyone, and welcome. I'm David Guerin. I work here at Dear Retirement, and I'm thrilled you're joining us today for our Medicare webinar. So, our mission here is just as simple: it's to give you clear, trustworthy guidance so you can make confident decisions about Medicare and retirement. So, today we'll walk through the ABCs of Medicare because, trust me, it is an alphabet soup. So, what each part means, how to choose coverage that fits you, and how to avoid costly mistakes. So, I encourage you to take notes and jot down any questions you might have. Then you can reach back out to us if you'd like. So let's go through some different things for Medicare. I'm going to bring up my screen right here and we can get started. So, this is our company. This is Dear Retirement. We have two of our owners right here. We have Ernest and Lauren Mitchell. And so they both have been doing this for a while. And so at Dear Retirement, everybody here, we believe in integrity, honesty, perseverance, loyalty, empathy, and education. So education is a key point. Our goal is to be the bedrock of trust for every client. So I work alongside Ernest and Lauren Mitchell, and together they've spent decades helping individuals plan for retirement, navigate Medicare, and make smart financial choices. So they're passionate about personalized solutions because your retirement is as unique as you are, of course, right? So let's jump into Medicare because today we're going to be going over what is Medicare, the parts of it, your options, next steps, right? So these are our spokes we have right here. So we have many things that we can do here at Dear Retirement, but a key one is Medicare and health insurance in the bottom right corner, if you see. This one, we help thousands of people every year. They can, renew their Medicare. They can sign up for Medicare. We help them with everything. So that's what we can guide you through. This is where we are. We are in Simpsonville, South Carolina, which is right near Greenville, South Carolina, and they've been here for years. So great place. This is the front. It's welcoming place. Here is the inside. We just love to have people come in, sit down, and talk to them personally on a one-to-one level. And that's what we can do for you. So let's talk about Medicare, right? Medicare is the largest health insurance program run by the US government. It's been serving over 65 million people. So as you know, people put in their paychecks, a little bit goes to Medicare. It's to help people who are over 65, right? So it's managed by the Centers for Medicare and Medicaid Services. So Medicare is divided into three parts, right? So we are four parts. We have A, B, and C and D. Now it's a little bit tricky, but we'll go over it, right? So part A is going to be part A and B are your original Medicare. So A is just going to be for your hospital stays, right? Hospital insurance. Things like hospital stays, skilled nursing facilities, hospice help, and also for home health. Part B is basically for your doctors. It's your medical insurance. Your doctor visits, your outpatient care, some therapies, for example, occupational or physical therapy, right? Part D is your prescription drug coverage. But Part C is an interesting one because Part C is going to be all these plans bundled together. So these are private plans offered by health insurance carriers that bundle A and B together. And they're often with extra things like dental or vision, wellness, even food cards, gym memberships, things like this, right? So they're very useful and very helpful for a lot of people. If you have original Medicare, it comes combined with the A and B and sometimes even D. So it's a good way to bundle everything together, right? So who's eligible, right? So the key thing is at 65, you're eligible, even if you're still working, right? So you may qualify also through a spouse or if you're under 65 and you have a disability. So the next thing that will be helpful is when can you sign up, right? So your initial enrollment period is 7 months. Is interesting. So you have 3 months before your 61st birthday, then you have the month of your birthday, and then you have the 3 months after. So this is called your initial enrollment period, right? and is very, very important. Trust me. Very important, because missing this window could mean late enrollment penalties. So timing is key. So remember this slide if you're near turning 65, right? All right, so let's go over some of original Medicare costs. So remember, original Medicare was A and B, Part A and B. So on one side, these are the projected costs in 2026, right? So for Part A, it's a monthly premium of 0. So most people, you paid Medicare all through your working years, all the way up until you retire, then you get to reap those benefits, right? So that is the premium. You don't usually have to pay a premium. You just have Part A premium at $0. The Part B is the deductible, and it is $1,716 for benefit period. So benefit period is when you go to the hospital, and then after that, it's a 60-day period. So it's if you go to the hospital, right? So we have things like the hospital stay copays as well, and skilled nursing. So as you can see, it's no fee for the first 60 days for hospital stays and the first 20 days for skilled nursing. Then after, it's a little bit of a fee, and then it's 100% after that, right? Part B, the projected costs here are, it's gone up a little bit. So the monthly premium went from $185 to $206.50, with the deductible being $288. But Part B is good because when you go to your doctor and you have to pay, Medicare pays for 80% and you pay for the remaining 20%. So this is original Medicare, which is good, but sometimes there's things that you might need as well that is not related to this, right? So this brings us to IRMA. Now, IRMA is going to be how much it's basically your tax brackets, right? So if you're a single person and you're making less than $109,000, which is projected for 2026, your Part B payment will have to be $206.50. But if we move up in the brackets, you can see that it goes up a little bit by little by little. So it depends on how much you make. They look at the past two, Social Security looks at your past 2 years to see your tax bracket and where you fall in that tax bracket. But for most people, under $109,000 is going to be $206.50. That is projected for 2026, right? So things that are not covered, which it's a little bit difficult. So we have long-term care, we have custodial care, your routine dental and eye care, and dentures, right? Cosmetic surgery, acupuncture, hearing aids, and like the hearing tests and exams. So that's a big problem many people have is original Medicare A and B doesn't cover everything. So what are your options, right? So now you have two options. What you can do is, one path is you can go to Part C that we talked about. So this includes prescription drug coverage, and some of those other things get thrown in there as well. For example, vision, dental, and hearing, right? So that's great. It's also gym membership, things like that. Or you could go the other way and go to a Medicare supplement insurance from a private company as well. This is not going to be bundled together. This will be A and B, and then you add in the supplement. So it supplements or aids or helps with A and B, and it'll give you extra coverage for things that A and B don't cover, right? So supplements are standardized. So one key thing is they must follow federal and state laws. You choose company and the price, and you must have both A and B to enroll in the supplement, and you will pay a monthly premium in addition to your Part B. So you pay a Part B premium, and then also another another premium, which will have extra benefits that A and B, original Medicare, don't cover. Your drug coverage is also not included in Medicare supplements. You'd have to purchase a Part D prescription drug coverage as well. So you can do it that way as well. It depends what you want to do. If you want to enroll with a Medicare supplement, most people enroll when they have both A and B. And you have that 6-month initial enrollment period we talked about. So you may be declined, though, based on health history or if you don't enroll during that period, right? So it's good to keep your eye out for here. Now, here's an example of some of the Medicare supplement. It's also commonly called Medigap plans. So you have many different plans. A lot of people like Plan G. So if you want the Cadillac of plans, Plan G, you have A and B, but then they help with everything else. So things like foreign travel emergencies, if you go to, Mexico, or, you go to Bulgaria, there's going to be a 80% coverage, right? So this is good for a lot of people as well. So it's up to you if you want to decide to go that way. You can see here are some of the deductibles you would be paying. So we talked about Plan G. Here's an example of a 65-year-old female in Simpsonville, South Carolina. And so you have to pick which one is best for you. And as you can see, there are different rates because they come from different companies, and you can see which one works better for them. Another option, which we talked about, was going to be the prescription drug after. You have to also pay for prescription drugs if you have Medicare supplement plan. So there's two ways to get Part D. You can get standalone. So if you just want to get a Part D plan, you can do that as well. Or you can go the other route with Medicare Advantage plans. So that's A and B, and then D also bundled together. So these plans are referred to as a MAPD, Medicare Advantage Prescription Drug Plan. So these are different ways for prescription drugs. So a lot of these will cost varying on the plan you choose, and prescription drugs are the formulary list of the plan. So these are the prescriptions you have, how expensive or what tier drug they are will depend how much you have to pay, along with your pharmacy as well. And you might get some discounts if you're receiving assistance from extra help as well. So the proposed prescription drug changes for 2026, the out-of-pocket costs will be capped at $2,100. So there's no more donut hole. So a donut hole is just before A and B covered some things, and then once you reached a limit, it didn't cover some things, and then you had another limit, and then it started covering. So you had this gap, or a donut hole, which it wasn't covering. But that's all done. There's only 3 phases for 2026. And they have a new thing that they started last year, which was the introduction of a payment plan for expensive prescriptions. So that'll definitely help you as well. And then we're moving on to the other step, which is very useful. A lot of people also choose our Medicare Advantage plans, right? This is Part C. So these are plans offered by different private insurance companies, and they include all the benefits and services covered by Part A and Part B, but they include extra things as well. So it may include things like dental, vision, gym membership, food cards, and prescription drug coverage as well, right? So it's a very useful one that a lot of people like as well. For joining the plans, you have to be, you can join during some certain times. So a big one is tomorrow, or not tomorrow, October 15th. And that's the annual enrollment period. So you can change from October 15th to December 7th. And then you have special enrollment periods. If you move to a new state, new county, something like this, this is also another time that you can also change these. Then the third one is the Medicare Advantage open enrollment period, which starts on the 1st and goes to March 31st. 1st. So there's some times where you can go, you can look, you can change your plans. So they give you a lot of options when you're choosing, right? So Medicare Advantage, what do you pay? What, it's a good question. So the first one was the Medicare Part B premium, maybe a monthly premium. Some though have $0 premiums, right? And then maybe a deductible as well. So you have some co-pays and co-insurance, but a lot of this depends on your in-network or your out-of-network services, right? But once you meet this yearly limit, you pay nothing for the covered services for the remainder of the year. So if you hit your limit in February, everything from February all the way to December, you don't have to pay. So it's great for hitting your maximum out of pocket, right? All right, so let's look at some different plans. As you can see, a lot of these are Medicare Advantage, and they come with the prescription drug plans as well. And a lot of them come at $0 monthly premiums. So this is why a lot of people like it. But you have a lot of things that are added in as well. So again, this is the same example where we're using a 65-year-old female from Simpsonville, South Carolina. So a lot of these plans, as you can see from these different carriers, they offer $0 monthly premiums, but some of them may differ in things like how much. Some people reduce the Part B Medicare you have to pay, so that's good, or gym memberships or food cards. It all depends, right? So it depends. You have to really speak with someone to know exactly what they're offering and what they can do. And we here at Dear Retirement can definitely help you along with that. We are experts here at knowing the difference between all of these plans, right? So we talked about when you can change plans. So if you're on a Medicare supplement plan, you can do it anytime, but you have to pass medical underwriting. For Medicare Advantage, we talked about the different enrollment periods. So we have the annual enrollment period, which is coming up this month. So it's from October 15th to December 7th. Then we have the open enrollment from January 1st to March 31st. So that's a good time to, if you don't like your plan, you can just switch between. That way you can know exactly what you're getting. But it's always great to talk to someone to know exactly what people want or what they need. So for example, I've talked to many people, and it's great to find out exactly what they want. Some people want some dental insurance, some people want vision, some people want gym membership. When we talk to you, we find out exactly what you need, exactly which plan works best for you, and we can fit you with that plan as well, right? So this new annual enrollment period is coming up, and this is a great time to give us a call or stop by our office in Simpsonville. And the new year plans are coming out actually tomorrow, but we can help you with this as well. So we worked, what worked last year with you in 2025, the plan might have changed. So it's great to review your plans as well, and we can help you with that too. So the Flex card is great as well. A lot of people like this because it can cover monthly expenses such as your groceries, your rent, utilities, gas, even Ubers, and over-the-counter products at things like Walgreens, CVS, or other pharmacies, right? So this is an example of one. This is a healthy options allowance, or the Flex card. It covers up to $200, right? So that was $200 a month. And things for, it even covered transportation costs, and they put it as taxi, Uber, or Lyft. So it's a great way when you have a Medicare Advantage plan. If you have this benefit, you can use it to, pay for your transportation to the doctor's appointments or to your hospital. So it's great for many people, right? So when you visit us, you can get a free Medicare roadmap. We'll show you exactly what to do. We can show you how we can help you find the best plan suited for you, right? We can give you a cost summary, and also you can get your annual drug analysis. We'll also can help you with other things as well, such as retirement income. We have a retirement analyzer software that can help you figure out what to do after Medicare. We have Social Security as well, analysis, as well as long-term care cost projection. So honestly, if you call or come into the office, we can help you with Medicare, but we can also explore other options for your retirement process as well. So I just want to say thank you. This is where we're located. If you want to reach us, the phone number is 864-309-0758, or you can also book an appointment online at dearretirement.com. So I just wanted to say thank you for listening. I know it was a lot, but I'm glad we got through it, and I'm glad that hopefully you might know more about Medicare and why it's beneficial for you and why calling us or coming to our office here at Dear Retirement can help you. We'll find exactly what you need and we can fit it so it's tailored for you. Well, I hope you guys have a great day or rest of your day, and I will see you next time.